There's still debate why COVID-19 is not called China virus, but COVID-19. Historically, scientists or doctors used to name drugs, diseases based on where it was discovered or who discovered it. For example, Japanese encephalitis, which causes swelling of the brain, resulting into things like headache, confusion, paralysis, coma, or even death. And it's mostly in Asian countries, and it has a very high mortality. But the good thing is it has vaccine available. And the reason why it's called Japanese encephalitis is because the first case was discovered in Japan in 1871, hence its name Japanese encephalitis. The next virus is West Nile virus, which first discovered in 1937 in West Nile districts of Uganda. Actually, I come from one of the districts in West Nile of Uganda, and that's where the disease was first discovered, and hence its name West Nile virus. And also in Uganda is Zika virus, which was named after Zika forest of Uganda in 1947. This was also because it was first discovered in Zika forest of Uganda, and that's where it got its name from. Another interesting one is Rickettsia australis, which is a bacteria named after Australia, and it causes a condition called Queensland tick typhus. And this disease was first noticed in soldiers which were situated in northern Queensland. And when they saw some symptoms in these soldiers, they took some samples and analyzed and found out what bacteria was causing it, and it was named Rickettsia australis. A disease that was caused by this bacteria was named Queensland tick typhus. Another interesting one is German measles. German measles is actually rubella, but it's commonly known as German measles or the little red. Because of the rashes it causes distinctive rash which lasts for 3 days. And other symptoms that German measles causes include joint pain, swelling of the lymph nodes, swelling of the brain, which can result into confusion, blurring of vision, headaches, and so on. And it also causes miscarriage in pregnancy, and if miscarriage doesn't happen and the mother progresses to have the baby is at high risk of developing congenital abnormalities such as deformities of the limb, deafness, and also blindness. And it's for that reason that if rubella is confirmed in a pregnant mother, for example in Australia, one of the recommendations is medical termination of the pregnancy. But of course it's all dependent on the decision of the mother. I'm sure all of you heard about Ebola virus, which has been causing a lot of problems, especially in some African countries. And this was named after River Ebola in Congo, where it was first discovered. Also in Congo is Crimean Congo hemorrhagic fever. And this one is a bit interesting because when they noticed strange symptoms, which was similar to Ebola, they decided to take some samples and send to US. And later on, some samples were taken also from Uganda and was sent to US. During that same time, some samples were sent from Crimea, which is part of Ukraine. It was sent by a Russian scientist. And when they analyzed the genetic makeup of these viruses, they realized it's all the same virus. So it was named Crimean Congo hemorrhagic fever, getting its name from Congo and Crimea of Ukraine. And the most interesting one of all is the Spanish flu, which is considered the deadliest pandemic of all time. And it started towards the end of World War I, and during that time most countries were fighting, so they were not reporting these cases except neutral countries, and by that time Spain was neutral, and therefore its media was not restricted from reporting these cases. But actually the first case was in the US, so it should have been maybe American flu or something like that, but instead it was named Spanish flu because it was freely reported Spain at that time. So why is COVID-19 not called China virus, yet all these conditions were named after countries or places in countries where they were first discovered? One of the reasons could be, over the years, scientists have moved away from naming conditions based on where it was discovered or after the person who discovered it. Rather, they started the naming on the characteristics of the disease and other parameters. Though if you look just recently, we have Middle East Respiratory Syndrome, which broke out in 2012 in Saudi Arabia and was still named after Middle East. The second reason could be due to increasing tensions, especially among countries, and also increased hate and stereotypes and racism and all this. So people try to move away from such nomenclature to prevent stigma or stereotype. So what are your opinions about this, and what do you think? Do you think COVID-19 should have been named China virus, or COVID-19 is the best suited name for it? Please comment and share your views. Also, please subscribe to my YouTube channel and follow me on Facebook for more. Thank you. This is Dr. Ice. See you next time.